歡迎大家出席今日嘅
Welcome to the press briefing. With us today, Dr. Chuang Shukwan, Head of Communicable Disease Branch of the Center for Health Protection, and Dr. Lau Ka-hin, Chief Manager, Hospital Authority. Dr. Chuang would first brief us on the cases. Good afternoon. As of last night, there were 6,211 newly confirmed cases, of which 2,270 were confirmed by the Hospital Authority, and another 3,941 were confirmed by the Public Health Laboratory. Altogether, we received 8,013 reported cases yesterday. Of the 3,941 cases confirmed by the Public Health Laboratory, 31 carried the L452R strain. 3,621 did not carry the L452R, that is the Omicron strain. Results are pending for 213 cases. For 76 of the cases, the viral load was too low, so the results were indeterminate. Of the 6,211 cases, 3 were imported, 6,208 were local infections. In terms of the rising trend, on February the 1st, there were 126 reported cases. Yesterday, we had 8,013 reported cases. So it was about 64 times of the 126 cases. So there was an exponential rise for 6 times, so 2 to the power of 6. So on average, we experience an exponential rise every 3 days. So the caseload is constantly climbing. So the public should remain vigilant and refrain from going out. And where possible, companies should arrange for their employees to work from home. Some people were puzzled why we chose to report the number of reported cases instead of preliminary positive cases. We were not trying to hide the number of preliminary positive cases, but we believe that the number of reported cases could better reflect the trend. And now I'd like to share the preliminary positive numbers as well. As of midnight, there were 9,369 preliminary positive cases. 2 days ago at the same time, the figure was 8,137. 2 days ago, it was 7,564. In the past, the number of preliminary positive cases could reflect the latest situation. For cases, after cases were reported by private laboratories, the results would be confirmed by the Public Health Laboratory. Most of the preliminary positive cases from yesterday would be confirmed later. So, and from the number of preliminary cases today, you can estimate the number of confirmed cases tomorrow. But now we are seeing a backlog at some different steps along the chain. So some of the preliminary positive cases are yet to be confirmed. So this figure could not reflect the entire trend. As of yesterday, we had more than 300 residential care homes that saw cases. Some of their residents or staff tested positive via the rapid test, and there were more than 300 such care homes. As of yesterday, more than 230 staff members and more than 820 residents tested preliminary positive. Some of them tested positive via the rapid test. We believe the actual number would be even higher. certain individuals who tested preliminary positive in the community would be given an electronic wristband, and some of them thought that they would not need to be hospitalized. But the fact is they would be given a wristband while waiting to be admitted. So the hospital authority might decide to admit some of these individuals. Hospitalization is actually a law-abiding isolation order, so we call for everyone to observe the orders. That's all for my part. Dr. Lau would now brief us on the hospital authority's position. We have 3,977 positive and preliminary positive patients at different public hospitals, the North Lantau Hospital, Hong Kong Infectious Control Center, the Asia World Expo Community Isolation or Community Treatment Facility. Another 1,900 patients are being isolated at the Penny's Bay Quarantine Center. More than 250 patients are staying in the Dorset Tsuen Wan Community Isolation Facility due to a large number of patients being admitted recently. There is a backlog in statistics, so we could not provide the details yesterday. And today I'd like to share more statistics with you. Of the hospitalized patients, about 19 are in a critical condition. They are aged 56 to 95, consisting of 16 males and 3 females. Another 30 patients are in serious condition. They are aged 41 to 103. These consist of 15 males and 15 females. Over the past 24 hours, a total of 32 infected patients passed away, including 17 males and 15 females, aged 45 to 103. Of the patients who passed away yesterday, the majority were the elderly. There were 27 individuals, aged more than 60. Almost all of them had chronic illnesses, and in the majority of those patients, we did not find any vaccination records. For the 45-year-old patient, he might be relatively young, but he had chronic illness and he stayed in a residential care home. He was in a very poor condition when he was admitted, and he had to stay in bed all the time. So we saw some relatively young patients passing away, but the majority of them had chronic illnesses or were staying in care homes. 7 patients passed away on February the 20th, and these patients were aged 66 to 93, consisting of 5 males and 2 females. Since the fifth wave of the outbreak started, 145 patients passed away in public hospitals. Apart from the 3 children, the majority were the elderly. In the past year or so, 350 patients passed away in public hospitals. Over the past day, 291 patients recovered and were discharged. And the utilization of negative pressure beds in public hospitals is 92%. And this is already the limit.
And also, about 50 patients were confirmed to be preliminary positive on admission or the screening. Some 30 patients in the same ward are classified as close contacts. And so far, 873 healthcare professionals are infected with COVID-19. And on the negotiation with private hospitals about a transfer of patients, St. Paul Hospital has agreed to offer 20 beds to receive non-COVID patients from the Eastern cluster or the Island East cluster. So we thank the St. Paul Hospital. It sets a good example for other hospitals, and we hope that more transferable arrangements can be reached with other hospitals. And we have an announcement. We have found that someone has uploaded video clips to smear the efforts of healthcare professionals under the HA. We strongly condemn any behavior and remarks which would stir hatred towards a healthcare professional. The situation is very bad, and the number of patients has surged. We are doing our best to help the patients, and the occupancy rate of our beds is at a record high. The HA has been increasing the number of beds to cope with the needs, and together with the government, we are increasing the number of community isolation facilities. We have deployed a lot of manpower to the front line from clinical departments in the pediatric departments, medicine wards, and so on, or orthopedics department. Beds from these departments are used for helping treating COVID patients. Because of the seriousness of the epidemic, all healthcare professionals will do their best to save lives. We hope everyone in the community would stand together and support the work of healthcare professionals. The HA reiterates that what is depicted in the video clips is not true. We urge citizens to be aware of the video contents. Thank you. Now we will take questions. Please identify your media organization before you ask question. The lady in a khaki jacket. Good afternoon. I'm from TVB. Recently, the drivers of many high officials are confirmed. So, was there any contact between the high officials and the driver, and what about the risk of a cluster? About the isolation order mentioned by Dr. Zhuang, were there patients who refused to be admitted to hospital despite receiving the notification from the HA? How would you deal with these patients? Did they claim that they had no symptoms, or did they claim that they had a negative test results? Now, you said there is a legal responsibility. So would patients who refuse to be hospitalized be held accountable? Now, the test results, there is a huge delay for test results. Many patients who were tested positive by antigen tests have been waiting a long time for the confirmative results, and by the time when they are sent to the quarantine center or isolation center, they have already spent 14 days. So it's a waste of resources, and also they have to wait in the isolation center before discharge. So would this discourage positive patients to withhold their information and cause more outbreak? The situation is very serious, and we have outbreaks of various scales in Hong Kong. I think many of us know someone who is a patient or a close contact, so I'm not going to comment on individual cases. When an isolation order is issued, I mean, when it is necessary to do so, we would issue an isolation order to patients who require the hospitalization. We would require the FSD assistants to send them to hospital. If they refuse to do so, then there will be legal responsibility, and we would involve the police if necessary. For patients who are tested positive at testing centers, they don't have to notify us. The results would be delivered to the CHP's laboratory, and if the test is performed by a private laboratory, and the laboratory would upload the information to a platform where we have access to about the delay of testing of test results or the delivery of samples because of the sheer number of patients. Yes, it is the situation. The lady in black. Hi, I'm from Orange News. As of today, more than 800 healthcare professionals have infected COVID-19. So how can we deal with the situation, and how would you handle the shortage of manpower? Like you said, we have 873 colleagues who have been infected. Our colleagues are living in the community. The exposure to the virus is about the same as members of the public. Within this week, for all frontline staff in public hospitals, they will have to undergo a pre-shift rapid test to make sure that they are not infected. If it is so unfortunate that our colleagues are infected in the community, we will be able to single them out quickly so that the hospitals are safe. Yes, infection among our colleagues would affect our manpower situation. The situation is very serious, and a lot of patients require treatment and hospitalization. So we have set up isolation facilities, including the Asian World Expo, the Infection Control Center, Penny's Bay, and so on. Many colleagues were deployed to these facilities. As a healthcare professional, it is our duty to offer care to patients. Our colleagues are having a very difficult time, so please we call for the society's understanding. So if there are any shortcomings, we ask for your apologies. So we will do our best to expedite the recovery of our colleagues so that they can return to their positions as soon as possible. The lady in black. Hi, Now TV, 3 questions. Now the new medicine has been delivered to Hong Kong. So how many doses were procured by the HA, and when will you begin the treatment? So under what situation will the patients be given the new drug, and when would remdesivir be given? So the new drug is for preventing complications or serious conditions. Given the delay, patients may not be given the new drug in the initial period, so we would affect the course of treatment. About enlisting the help of the private sector, besides St. Paul Hospital, what about negotiation with Gleneagles Hospital, the St. Therese Hospital, and Sanatorium Hospital? So how will the beds be distributed? What kind of patients will get these beds in the private hospitals? A question about the Department of Health. For patients who need to be hospitalized, they need to observe the isolation order. So how many patients refuse to be hospitalized? For patients who are tested positive at home, and if they test negative on the 14th day, they can leave home. So will they have to serve the isolation order?
If 14 days have left after testing positive at home and the RIT result is now negative, we would arrange to cancel the hospitalization order after working with the hospital authority. We do not have the relevant statistics in hand. Since the COVID-19 pandemic started, we have seen new treatments and drugs. And at the HA, our experts are monitoring the developments around the world as well as the mainland. If new clinical treatments or evidence are available, we would explore whether they could be introduced in Hong Kong. Of course, we would make reference to different data regulators and manufacturers. We have mechanisms in place to first assess the drugs available to ensure that they are effective and helpful for patients. And we would also estimate the needs of our patients before acquiring the relevant products from pharmaceutical companies. While we are still in negotiations, we might not be able to disclose the relevant information, but our experts are constantly monitoring the situation and following up on them. And as for our collaboration with private hospitals, we are happy that in a day or two, St. Paul's Hospital will start accepting non-COVID patients from mainly the Island East cluster. The 20 beds available would be important because the beds we free up can accommodate new patients. We are in discussions with different private hospitals with the hope that they can accept more of our patients. And we are mainly looking at recovered patients, daycare patients, those receiving dialysis and radiotherapy services, or those who were operated on. If there are updates, we will certainly make further announcements. Next question, please. The gentleman on the back row. I'm from AM 730. Yesterday, Dr. Au did not tell us about the criteria for announcing major outbreaks, and there were no updates to clusters on the website. I'd like to know when major outbreaks would be announced for patients who have recovered before or after 14 days. Can you tell us how they can produce the necessary proof to show to the employers? You talked about a backlog of preliminary positive cases, and as of today, are there any cases that are yet to be confirmed after 24 hours? Given the serious community outbreak right now, if an outbreak takes place in a company, it would be hard to ascertain whether the outbreak originated from the company itself or from the community or housing estate. So we are giving priority to residential care homes for the elderly. That is why we are focusing our efforts on these facilities. For other cases, we hope employers would conduct disinfection if cases are found, and they should arrange for employees to work from home or provide testing for the employees. As for the proof that one has recovered, I have no further updates. The patients themselves should receive an SMS showing that they tested positive or preliminary positive, and we call for employers to understand the situation. If further proof is needed, then we would need to explore what to do, since we are looking at a very large number of cases. So we call for employers' understanding. Next question, we will take a question in English. The lady on the back row, please.
Thank you, doctors. I'm with Bloomberg News. I wanted to follow up on the 3 cases of the very young children and infant deaths. Dr. Lau Yulong said that he reviewed the case files for these patients, and he said that they all seem to have suffered from a brain condition called hydrocephalus, which caused muscle twitching or convulsions. Can you confirm if that was the case? I think the convulsions were mentioned for the 11-month-old baby yesterday, whether that also occurred for the 3-year-old and the 4-year-old case. There have been studies from other countries such as Sweden that also discovered this trend. Is there any effort to conduct more research into this phenomenon of children being infected with the Omicron variant? My second question is there have been concerns from parents where children who have been admitted to the hospital, the parents cannot accompany the children. So they feel they're put in a very difficult position if they're not able to be there with their child, especially for those who are very young. What can the hospital authority help in this situation? Thank you.
Up to this moment, for the phase 3, there are 3 children who passed away and found to have COVID positive. Actually, these 3 cases were referred to the coroner for investigations. Up to this moment, we can't confirm the diagnosis, and we will follow up the coroner as well as what has been happened to find out the cause of the death. However, we urged our parents to have the vaccination for themselves in order to protect the children who cannot have vaccination. For example, for the 11-month-old baby. And at this moment, the children who are aged 3 or above can have the vaccination now. So please bring your children to have the vaccination in order to protect themselves. Yes, for the arrangement of the children and parents in the same hospital, we try our best to arrange the children and the parent who are be confirmed to be COVID positive in the same hospital in order to, so that the parents can give care to the children. However, as you all know, there are many cases and many children who have been infected. It takes time for our staff to arrange the suitable places for them.
好，呢邊咩二個行黑色外套嘅呢邊
Next question.
So can we know whether the 3 young children who died recently after contracting COVID-19 were infected with the Omicron variant BA.2? Professor Lau Yulong also said this morning that he raised a concern that whether the Omicron BA.2 was the reason behind the unusual deaths of those children. So does the HA have more findings on it? And second, can we have the number of infected HA staff today? And how many infections were there since February 1? And will the HA continue to release such number every day, because it wasn't reviewed yesterday and Sunday? And third, some suggest that cross infections was caused among government drivers because they had meals together in a room. Is there any government drivers being identified as close contact, and what is the possible reason behind the possible outbreak? Thank you.
I understand from our laboratory colleagues that the circulating strain now is BA.2. But of course, the 3 children who died from recently, we need to take out their samples and do the exact sequencing to confirm. And the reason for the any outbreaks in the community we observe is due to, for example, they live together. They have mass of activities. Most of them are coming from that, and they have meal together. These are the risk factors for the routes of transmission, as we know all along. Of course, in certain situations, such as those we reported before, there will be airborne transmission under certain situations.
Up to today, there are 873 staff of hospital authority being infected with COVID-19. We are trying our best to collect this data. We will report this data when we have the confirmed figures in any platform, including in this conference. Yeah.
下一位嗰邊仲
Next question, please, the gentleman at the back.
Could you explain why the CHP no longer thinks the number of preliminary positive cases is a useful figure to describe the pandemic situation? And how is the new figure that you provided a better indicator? And you talked about more than 800 hospital staff have been infected with COVID. So under what circumstances will these staff be allowed to return to work? And how have services been affected by these infections? And also, what do you think about calls from a political party for authorities to recognize the test results of people's own rapid tests in order to deal with the large backlog of cases? Is that something the government is considering right now? And also, are there any other private hospitals apart from the St. Paul's Hospital which are willing to accept non-COVID patients? Thank you.
If you remember the way we're reporting the cases, for example, in before February or in January, we report the number of confirmed cases last night, and then we report the number of preliminary positive cases at hand, for example, at 3 p.m. Because for example, if the specimen was collected in the morning, and if the preliminary positive cases, the laboratory specimen usually in the morning, they would be sent to our laboratory in the afternoon, and then we will confirm those cases in the evening. That's the very quick confirmation. So the next day we will confirm those cases. But recently, because of the huge amounts of samples, both from the private laboratory and also to be confirmed by our laboratory, there is some delay in sending those specimens and also in confirmation of those specimens. So those preliminary positive numbers are those cumulative numbers that have not yet been confirmed. Some of the cases we observe, they reported the case a few days ago. Some of them are reported, for example, yesterday. So this cumulative numbers is those that have not yet been confirmed, but they have been reported to us several days ago. So we think that in order to look at the recent trend, the daily trend, we need to have another figure that can reflect the latest situation. So we use a daily number of notification to us. So all those cases who have been tested positive by the private laboratory or hospital authority, they will be all fit into an online platform. Almost in real time. So we will receive those cases in the notifications from the online platform, and then we count those numbers. So these numbers will reflect the latest situation. So how many we are receiving yesterday or the day before in a 24-hour basis. So we can observe and this number and we can that can reflect the latest trend. So the preliminary number, of course, we have, but that number is will have some limitations. That's why we try to take out all those daily numbers to check the trend. And of course, I have reported the trend in the recent 3 weeks. So the number of notification on 1st of February is 126, and yesterday is 8013. So it's almost 64 times.
Although we have 800 and something infected staff, our staff are still working very hard to take care of the patients, including the COVID and non-COVID patients. I want to take this chance to thank our colleagues to take care of our patients in the hospital authority as well as other colleagues in other departments to take care of the COVID patients. For those infected staff, they should fulfill the criteria set by CHP for the termination of isolation order. They should recover from the disease. And at the same time, between this week, all of our staff, including especially the clinical staff, should do the rapid antigen test before going to the work in order to protect themselves as well as our patients. For the collaboration with the private hospital, we are happy that St. Paul's Hospital has offered 20 beds for the patients, mainly the non-COVID patient for in the Hong Kong West clusters. We are discussing with other private hospitals, and they are very kind that they can offer more beds to our patients for the rehabilitation, for the radiological examination, hemodialysis, and as well as some surgery. We are looking for more opportunities to collaborate with them.
下一位，呢邊最後嗰行單。
Next question, please. The lady at the back. Good afternoon, Ming Pao Daily. The HA has moved all the patients waiting outside to indoor areas, but hospitals like Caritas Medical Center told us that no treatments would be offered to those patients because they are not admitted yet. They are only given antipyretics. And some patients even passed away before treatments were offered to them. So any more updates on that? For patients who have been moved inside, how many patients are there and what kind of treatments would you offer them? According to some medical staff, patients are mixed with COVID patients, so there is a risk of cross-infection. So how will the HA control the risk? And about the 103-year-old deceased patient, is the patient the oldest patient who passed away? More than 100 people have died during the fifth wave. So what's the breakdown in terms of the age, vaccination they received, the variant strains, and so on? The situation of these patients deteriorates quicker because of the delay. Now, in the near future, will you continue to offer us the data you just gave us? And what about data and information on major outbreaks? How would you strike a balance between the public's right to know and other considerations? Will the lack of transparency hinder the public's knowledge of the epidemic?
We looked at the 112 cases in which the patients passed away. Only 7 patients received 2 doses of the vaccine. 63 were residents of elderly care homes. The majority were relatively old, and even the relatively younger patients stayed in care homes or had chronic illnesses. For the latest position, I would defer to the HA. According to our information, the 103-year-old patient was the oldest patient who passed away. last week, the weather began to get cold. The HA started to move patients back indoors. We deployed different facilities, including facilities for physiotherapy, break rooms for staff, our doctors and nurses would continue to attend to the patients. They would certainly not be ignored. Like I explained, some patients could be discharged, but because of different reasons, they could not return to their original place of residence, such as residential care homes. Certain elderly care homes did not have enough staff, or some of the staff members tested positive, but the patients could actually they were fit for discharge already, but but due to different reasons, they couldn't be discharged, and as such, they stayed in our hospitals. On Sunday, a social welfare department facility at Choi Wing Road received some of these patients, and that helped vacate some of the beds at the HA. Our infection control experts would offer recommendations on all patient facilities, including the placement of beds, the wearing of masks. The gowns should be to be worn by our staff members, and this is certainly not ideal because these facilities were designed for purposes other than accommodating patients. But given the severe situation, we would exhaust all possible means. Some wards from other specialties were converted in order to accept confirmed COVID patients, and other doctors were already offering assistance. So we are exhausting all possible means to take care of our patients. But please do not forget that the HA is also offering treatment for non-COVID patients. Patients such as those suffering cardiac diseases, stroke, or other acute conditions are constantly receiving treatment at the HA. So apart from doing our best to take care of COVID-19 patients, we must reserve sufficient capacity to accept other patients, such as those who are injured from traffic accidents. And every day, the heads of clusters would monitor the latest situation, and we would do our best to take care of the patients. Next question, please. Like we said, we understand that up-to-date and accurate information are very important for the public to alleviate public concerns. Transparency has always been a key objective in the information disseminated by the HA. But like I explained in recent days, at times, given the large number of patients admitted, it might not be possible to always publish the latest and most accurate information. we have more than 40 hospitals across 7 clusters, and we had to collate all the information received. So we would certainly publish the information we gather. And we agree that publishing information is important to alleviate public concerns and help fight the pandemic. The gentleman in checkers, I'm from RTHK. Dr. Chuang talked about an exponential rise in caseload since the 3rd of February. The numbers doubled every 3 days. And did you observe a trend in the speed of the rise before and after measures were put in place? Some people received test kits, and some complained about arrangements at community isolation facilities. How would the authorities deal with such scenarios? Some people told us that a person told us that he tested positive on the 6th. He was admitted to Penny's Bay and AWE, and on the 17th, a result was announced at Penny's Bay, and the patient tested negative via a rapid test. Does this show that the arrangements at Penny's Bay were lacking? Nowadays, a lot of people would purchase test kits from different places, and some of these test kits claim that they received certification. So how can the public know whether the certification is reliable? Some of these test kits are very cheap and some cost more than $100. So how can the public make a choice? I offered some approximate statistics. We are yet to see a downward trend. So I believe more time is needed before we can see whether the social distancing measures are effective, but nonetheless, these measures would require cooperation from the public. So we urge everyone to go out less and work from home if possible. For members of the public who test positive via a rapid test, the result would have to be confirmed. At the end of the day, rapid antigen tests might give rise to false positive or false negative results. So at the end, a PCR test must be taken to confirm a case. For rapid antigen tests, the CHP's website contains instructions on how these tests could be taken. And information or examples of RAT kits with a considerable level of accuracy are available.
The lady over there. Good afternoon, doctors. I'm from Hong Kong Economic Times. Now, Dr. Zhang, now the results returned by the Huoyan laboratory, will you need to confirm those results, or will they be treated as confirmed results like that of HA? In terms of a delay of delivery of preliminary positive samples to the CHP, what's the reason, and how can we address the issue? A doctor for Dr. Lau. Do we have a figure concerning the number of patients under the age of 11? How many of them are staying at hospitals? Will the accompanying adults or carers be allowed to stay at hospitals with them? And you said the St. Paul's Hospital has offered 20 beds for patients from the Island East cluster. So will there be any extra charge for these patients? And a clarification, you said so far 873 healthcare staff have been infected. So you said from the between the 9th and 18th of February, there were only 829. So where did the extra number come from? At present, all the samples from the HA will be confirmed. If there is any change, we will announce them as soon as possible. Sometimes the samples are not immediately delivered to our laboratory from private laboratories. We understand that there is a huge pressure on them, and it has already exceeded their capacity. So we will just do our best. Yesterday, the number of samples sent to the public health laboratory has increased a lot. So maybe they include samples from before. So today is the 22nd. As at 6 a.m. this morning, we have pardon me. I don't have the breakdown about the age of patients in hospitals. Allow us to give you a comprehensive set of statistics when we are ready. About private hospitals, all patients transferred to the private hospitals from the HA, including to St. Paul's Hospital with 20 beds. Patients only need to pay the public hospitals charge level, including CSSA patients. Let me clarify. As at today, we have 873 HA staff infected, not just today. If it is just the number today, then it will be a disaster. That is the accumulated figure. So like the report has said, and like I said, we would do our best to collect the statistics. As of today, 873 colleagues were infected. That depends on the situation. We need to discuss it with the family members of the children. If the child is infected and the carer is not infected, then the carer is exposed to risk. And the carer must understand that infection control measures have to be observed during the care for the child. In terms of, in view of the shortage of beds in hospitals, isolation facilities, and so on, we need to review each and every case and arrange the suitable plan for different families. Next question, the gentleman. Hong Kong 01. First question for Dr. Zhuang. You said some patients refused to be admitted to hospital. They believed that they have recovered and they didn't want to undergo 2 weeks isolation. So if a patient is tested positive on day 1 via an antigen test, then when they are sent to isolation, will the clock start counting day 1 or counting the day when they are sent to isolation facilities? Now, a question for HA. Dr. Lau Yulong said on a radio program this morning, the 3 children who passed away were, in fact, have symptoms like acute encephalitis, hydrocephalitis, and URTI. So given this discovery, For younger patients admitted to hospital, what about their conditions? We don't count rapid test as a preliminary positive case. We don't know. We wouldn't know if you perform a test at home. So we need to do a PCR test to find out. For every child who is admitted to hospital, first we would do a clinical check for him, a blood test, and so on. If needed, we will even perform a brain scan. For the 3 children who unfortunately passed away, they were given these tests. For the 11th-month-old baby, brain scan was performed and encephalitis was discovered. In terms of the detailed medical record, I didn't read them. These cases have been referred to the coroner's court for investigation. In any event, parents must be very anxious when their children get sick. We understand that. That's why we attach priority to children, young children, especially those under the age of 2, when during triage, they will be arranged to admit to hospital for treatment and observation with priority. If necessary, even brain scan will be arranged for them. The last question, the gentleman over there. Hi, Independent News. 2 questions. What about the medication inventory of HA? Do we have enough doses of courses of remdesivir? Now, there are lots of construction sites with infection. So would you require more construction sites with infection to suspend work? So far, we have enough drugs to treat our patients. Of course, the number of patients is rising. More patients will require treatment. We will pay close attention to our stock and continue to procure drugs from overseas and so on. Order has been placed earlier on, and we are waiting for the delivery. We'll make sure that there is enough medication for our patients. Like I mentioned, we have many cases in the community. We cannot pinpoint the infection, whether it happened in construction sites or whether the patients that caused the virus in the community. If the supervisor of a construction site found that there is an outbreak, thorough disinfection should be carried out, and the construction sites should suspend work for 7 days, and all workers should undergo a rapid test. Thank you. This is the end of the media briefing.